Every day that Ebola is allowed to spread, the possibility of containing it becomes more remote. Ottawa has promised millions in aid and supplies, even doses of experimental vaccine. All of it vital, but is it on the move? CBC health correspondent Kelly Crow takes stock.
As the crisis on the ground grows, so do the international calls for help. After months of increasingly desperate appeals, aid is slowly starting to move. A team of Chinese medical experts arrived in Guinea on Monday. More than 100 Cuban doctors are getting ready to go into the infected zone. And in Liberia, a German aid group is building a 44-bed Ebola center.
America is deploying our doctors and scientists.
The U.S. has promised to send up to 3,000 medical military staff and build 17 new treatment centers. But what about Canada? A month ago, Ottawa offered to send up to 1,000 doses of experimental vaccine. That vaccine is still sitting in a freezer at the National Microbiology Lab in Winnipeg.
It does seem like a long time, I know that, but there's huge issues with this.
Canada's chief public health officer says the logistics of sending it are still being worked out. The vaccine has to be kept cold, and since it's experimental, health officials are trying to set up some quick research protocols to get information back about whether it works.
Partly it's where would it go, partly it's who would administer it there. There's got to be a physician who's willing to administer that. Partly it's also informed consent to be sure people understand the risk they're taking with this vaccine.
10 days ago, Ottawa also offered the World Health Organization more than $2 million in personal protective equipment, but none of that has been shipped yet either.
They identified what they needed. I believe it's face shields, and we're shipping several 100,000 face shields, and that'll happen in the next few days.
Well, this is quite shocking because when we had an emergency debate on Ebola, we were told that the Canadian government, the Conservatives, had mentioned that all of this aid was on its way.
Opposition MPs have called on Ottawa to send military aid.
We should be sending the Disaster Assistant Relief Team, the DART. We asked for that.
What Canada has already sent are its scientists. Rotating teams of specialists from the National Microbiology Lab have been staffing a mobile diagnostic unit in Sierra Leone since the early days of the outbreak. Kelly Crow, CBC News, Toronto.